Good morning, everyone. Thanks for being here. Today, I will share our work on new community-based intervention models for cardiovascular diseases, and focusing on CVD management and innovations from both global and Chinese sides. 这个往下，哦好。Today I will talk about three parts. First, the burden of cardiovascular disease and the prevention challenges we are facing. Now, we can say the cardiovascular disease is still the top cause of death in both urban and rural China. Since 1990, the cases have gone up by over 130% and deaths by nearly 90%. This fast increase is a big challenge for our health system. The data shows we can't just rely on hospital care. We need to act at the population level. So now, as we all know, the Healthy China 2030 plan sets big national goals for improving public health. To hit these goals, we have to go beyond hospitals and work in communities. Real prevention means putting health management into daily life, where people live, work, and grow old. So community programs are not optional, they are a must. We can see this table. In 2015, the baseline CVD mortality rate is about 238%, but our target in 2022, we have achieved the target goal is decreased about 12%, and in 23 we will achieve the decrease rate about 20%. So it's still a big challenge. Now, this table just shows the Lancet journal list 21 key strategies for chronic disease prevention, and many apply directly to heart health, like tobacco control, cutting down on salt, and encouraging exercise, just to name a few. The most important thing is putting them into practice. These strategies only work if we carry them out well in community. So it's about primary prevention and secondary prevention, so globally, CVD prevention has moved towards multi-level integrated approaches. In China, we are adjusting these models to fit our local situation. So the key to success are standardized medical care, achieve community participation, and data-driven tools. Now, so this, like mobile health and AI. Next, I'll show some examples of each. Now, the first, let's start with all-around multi-level interventions. This system connects national policies, community health workers, and individual patient care. They make sure care is standardized and continuous, not broken apart between hospitals and communities. One Chinese example is the CHRCP project. It's just in China is how to say southeastern China and the southeastern China. It's a multi-center cluster randomized controlled trial, is RCT, and is involved in more than 34 rural patients and in more than 300 villages. This program used standardized treatment plans, lifestyle guidance, and performance rewards. Its goal was to test if strict blood pressure targets, such as lower than 130 over 80, could lower cardiovascular disease and cognitive problems. So we can see the CHRCP got great results. First is blood pressure control, improved by 30%. Major cardiovascular disease events dropped by 20%, and all-cause deaths fell by 15%. It also cut dementia risk by about 20%, and the project even influenced international guidelines. It was cited in the 2025 US hypertension guidelines. So it's a great success in community-based CVD prevention. Another important example is the Hope for a trial in Canada. It shows that community-based care can control hypertension well, just by non-physician health workers and using simple, easy to scale, easy tools. This proves high-quality CVD prevention is possible, even in areas with limited resources, just in relative poverty area. So it's a big step for global health equality. Now, the second major area is mobile health-based intervention. We all know this fast increase in information is an era of information, is an era of AI. Now, with smartphones and wearables becoming so common, the healthcare can reach far beyond clinics. mHealth makes prevention more accessible and more personalized. Now the phase trial in US just is a nice trial, showed how community digital tools tailored to local culture can boost heart health effectively. We can see it's about African American adults from 16 churches in Minnesota. The community-based health intervention guided by life's simple 7 framework is just about exercise, weight control, and nutrition, just like that. It's about 10-week program, health education, diet self-monitoring, and social sharing. Just is supported by church-level tracking and engagement. So it's simple, and the sample size is not big, but it's not large, but the effect, but it's effective. So it reduced the gaps in CVD prevention. Now, just we can see another trial in Japan. It's published in European Heart Journal, and this HERB-DH1 trial just use the digital therapeutics can help manage hypertension. Patients used an app to monitor themselves blood pressure and change their lifestyles, had better blood pressure control. And this shows that technology-driven behavior changes can work and last. Now we can see this China heart study is a very large national project covering over 5 million people. So how to say? Fubai Hospital just is in charge of this China heart cohort. By combining village doctor support with digital tools, the program provided large-scale, low-cost interventions. And we can see this Ministry of Finance and the National Health Commission in China supported this large-scale cohort is a perspective, and covering 31 provinces and more than 400 counties nationwide. So it also involves more than 2,000 primary healthcare institutions and 20,000 medical professionals. So it's a very challenging work. And in this cohort, we just launched a smarter project. This project is cluster randomized controlled trial. Is more than is more than 4,000 adults. Just its innovation, interesting is we how to say we education the village doctor. You know, in China is a rural, especially in rural China, the village doctor had a very big role in control blood pressure, in control high high glucose and high and just a chronic diseases. So, but there is some difficulty is the as how to say as our patient in rural areas just can't easily access the new or the novel techniques about CVD prevention, and also just education system. So such as lifestyle counseling, medication, and medication adherence support. So that's a very big challenge. And the SMART project just shows that we use a village doctor and they use how to say the digital tools can cut cardiovascular risk and strengthen the primary care in rural China. And the second is in China is a miracle AF trial. This is just focused on older adults with atrial fibrillation. This just use a remote consultations and guideline-based care improved how well patients took their medicine and their cardiovascular outcomes. So it's just the rural in the rural area the medical institutions had a remote connection with the big hospital, and the very professional doctors just look at how to say just look at the remote the how to say sorry. Yeah, the village doctors just perform the EEG and to screen the risk factors for atrial fibrillation. If the patient has a big risk for this disease, so they will upload the information to the specialist, and they receive the consultation and the medication management. So this telemedicine platform support village doctor care model is just very effective and can control AF greatly. So the third part is AI-driven CVD prevention and prediction. AI is changing prevention. It can analyze the variable data, imaging, and electronic health records. So for early detection, and the genomic data helps find new risk markers, and the large language models assist with clinical decisions and patient education. So the AI just how can I help you? How can I help the village doctors? How can I help the patients? So it's a very new tool. And the AI enhanced electrocardiography to predict heart disease can support small patterns and that humans can't see before any clinical signs. It's cheap, non-invasive, and easy to use for population screening and early intervention. So it's very AI ECG is just is becoming more popular, and so in Fuwai Hospital we also designed an AI ECG system, and now just use in more and more areas to just to prove its effect. So and for example, in blood pressure research, machine learning integration of multimodal data identifies key features of blood pressure regulation. So AI integration model, just like machine learning, can merge genetic, metabolic, and clinical data to uncover complex patterns in blood pressure regulation. And the final, I just share our ongoing work of community-based blood pressure control. It's just based on AM 24 hours AMBP monitoring. So this project is supported by innovation project of the Chinese Academy of Medical Science, just Fuwai Hospital. It covers 10 cities and nearly 40 community health centers. And it's focused on the hypertension population, just blood pressure less than 140/90, and with high cardiovascular risk. So it's more interesting is use AMBP to assess blood pressure to identify most hypertension patients is just high. So we use smart variable ambulatory BP and the wireless real-time transmission the data. So we can see the blood pressure status, and we also this just the qualified rate of AMBP monitoring is more than 90, and we also build the dataset platform for data. And these are our results, the status of different BP phenotypes. We can see mass hypertension in hypertensive populations account for more than 50%, and the nocturnal dipping status just account for 46%. So it's amazing. This large scale shows that hypertension, pre-hypertension status is a high risk for blood pressure progression. So everyone just blood pressure showing 120 to 139 should be more, should be, how to say, is a significant warning sign for blood pressure. So we are using AI and innovation to build a smart system for hypertension prevention and control. We hope to reduce the burden of cardiovascular disease at the population level. Thanks for listening. That's all my sharing.